Okay, good afternoon, and thank you for being here with us. Uh, my name is Fermin Leguen. I'm the Acting Chief Health Officer for the Southern Nevada Health District. And today we are very happy to tell you that this morning we received our first shipment of the COVID-19 vaccine, and this is the one coming from Pfizer. Uh, this shipment is containing 12,765 doses of the vaccine. Those doses will be delivered to local hospitals here in Clark County, and they will be administered to healthcare providers through the week. We will also be receiving additional shipments of vaccine in the following weeks, and that vaccine will be administered according to the tiers already mentioned by the state. The initial supplies of vaccine will be provided to the critical populations identified by the Center for Disease Control and Prevention's Advisory Committee on Immunization Practices. Joining me today to answer your questions and discuss our vaccine distribution plans, we have Joanne Rupiper, who is the Director of Clinical Services. Also, Jeff Quinn, who is the manager of our Office of Public Health Preparedness. And also Mickey Shondao, who is our Community Health Nurse Supervisor for immunizations. Mr. Corey Borges will be facilitating this call. Thank you. We will be happy to answer any questions that you have about the vaccine distribution today. Thank you.
If you want to, okay, here we go. First question is Mary Hines. You are now, hold on, there you go. Go ahead.
Good afternoon. When do you expect the first dose of vaccine to be given? And do you know who will receive that dose?
Joanne? You're mute. Joanne, you're mute.
Oh, there we go. Hello, everyone. Yes, we have delivered vaccine to a local hospital, and they are starting to immunize their hospital employees. So they had them all in line when we arrived. And so 1 o'clock, they should be starting giving vaccine already.
Okay. One more question from Ms. Hines.
Can you please tell us the hospital?
University Medical Center.
Thank you. Have all the acute care hospitals received the vaccine at this time?
Not yet. We're contacting them. We had a plan in place, so we are asking them if they would like their vaccine earlier, or do they want to stay on schedule, and we're still determining that.
Yes, Joanne, you might want to tell them that there was an original schedule for Wednesday, but
correct. Yes. Yes, we were expecting the vaccine either today or tomorrow, and we had a regular schedule set up, but we had a hospital that was ready to go, and so we delivered the vaccine there today, which is UMC.
This is just a reminder, if you would like to ask a question and you are joining us, you can either type your question in the chat box, you can hit the raise hand button under the participants list, or if you're just calling in, hit *9. We will call on you in the order in which those questions are received. And we have a question from John Trainer. I'm asking you to unmute.
Yes, thank you. Just two questions, if I could, right now. The Pfizer vaccine needs special care when it's being stored. Will that affect its distribution at all, or what steps are being taken to make sure that vaccine stays as cold as it needs to?
You want me to go ahead, Dr.
Yeah,
Ligon?
please.
Sure. Before, we have been working with the hospitals to make sure that they have that ultra cold storage. And then they have continuous monitoring of their temperature, and that is reported to the state immunization office. So that was all in place before the vaccine ever came. So the vaccine was shipped in a special containers with dry ice, and then we transported it in that same shipping container, and then we can put it in their freezer. If they do not have a freezer, then we can thaw it out, and we can also deliver it in its thawed out state, which can be kept in the refrigerator then for 5 days.
Our next question comes from caller ending in 5996. When I unmute you, please identify yourself.
Hi, Jacqueline Schultz. Hi, Jacqueline Schultz from Fox 5 here. Can you talk about the security measures in place currently at the site for distribution, transport, whatnot, and how other state and national partners have been involved in it?
Jeff?
Yeah, so the security measures that we provide for the transport and dispensing of vaccine are pretty standard. We've done a lot of drills and exercises prior to receiving COVID-19 vaccine. So we have a very close working partnership with our local law enforcement at Metropolitan Police Department, as well as the other city police departments. We work through coordination through the Southern Nevada Counterterrorism Center to have information sharing between law enforcement agencies and the operations that we're conducting out in the community. So for the transport of this vaccine this morning, we were able to collaborate with our partners to arrange transport and security for that vaccine. Once the vaccine is received at the hospital, UMC police officers continue to escort that vaccine to where it is ultimately stored. In the future, much like the COVID testing sites that we've had in the community, folks will find a presence of Clark County School District Police, Las Vegas Metropolitan Police Department officers, as well as North Las Vegas PD or Henderson for those various venues.
Next question comes from caller ending in 4861.
Hello, this is Tiffany Lane with Channel 3. Thank you for taking my question. I was wondering, we've been getting a lot of messages from family members of COVID patients, either in the ER, urgent care, or in hospitals. They're wondering, are they able to get the COVID vaccine? And if so, in what tier would that be?
The question is about people who already had COVID?
Yeah, so COVID patients who are either at urgent care or the hospital or the ER, their family members are just wondering, are they able to get the vaccine and in what tier?
Well, they will be able to get the vaccine, you know, at the time that it is administered to the general population according to the tier where they belong into that population. So one of the things that is not clear yet is how long natural immunity, meaning immunity that is coming from somebody who had the disease, how long that immunity might last. So that's why the vaccine will be offered to everybody in the community, regardless of whether the person had the disease before, because the expectation is that the vaccine protection most likely will be longer than the one acquired from natural immunity. But again, that still is not quite clear. I don't know if that answers your question.
Our next question comes from John again.
Yes, thank you. A two-parter. One, what is the reason for the early delivery, the Monday today instead of Wednesday? And the second question is, this all seems like it's happening very fast. This is rapid for getting a vaccine approved, rapid for getting a vaccine delivered. It's amazing, but how do you ensure safety here before people get it?
Okay, I will start, and Joanne, you can. Okay,
Sure.
well, the reason for delivering the vaccine today, I mean, from us to the hospital, is because first, we didn't have an exact day of when the vaccine will arrive here. So we have a time frame somewhere between Monday and Wednesday. We didn't know exactly which one of those days will be. So the vaccine arrived early morning here today. And as soon as the vaccine arrived, our first step was to notify the hospitals that the vaccine is here and it's available. So in this particular situation, UNC it was already prepared to administer the vaccine, and they decided to go ahead and start vaccinating the employees. But our decision of deploying the vaccine today as opposed to waiting for Wednesday has no relation with safety of the vaccine. Safety of the vaccine was already established through the field studies that were done that actually led to the FDA approval of the emergency use authorization.
Yes, and I'll add that our plan was that it would be distributed to the hospitals within 24 to 48 hours upon receipt of the vaccine. We really weren't expecting it this early. They even sent an email saying, well, it's coming at 10:30, and then 2 minutes later, we had the vaccine. So it was unexpected, but we did plan on it within 24 to 48 hours. So Wednesday, we knew we'd have the vaccine. So that's how we did a lot of the planning around that day.
Our next question is a follow-up from 5996.
Hi again, it's Jacqueline with Fox 5. Wanted to ask, for the CDC recommendation, pregnant women should consult their doctor. Immunocompromised people should not get it, and also 16 and over. How is that going to be managed by the Southern Nevada Health District and anyone on the front line, say a pregnant worker who's on the front line?
Well, we will follow the CDC recommendations. So the vaccine will be offered to members of this community who are 16 years old and over, which is one of the recommendations. Regarding pregnant women, that will be an individual case-by-case decision, and the decision is actually from the person, in this case for the pregnant woman, who need to get advice from her physician whether she can get the vaccine or not. And regarding people with immune compromise, again, they will have to get advice from the physician before getting the vaccine, as is recommended by the CDC. So we will follow the CDC recommendations on that regard.
Okay, Next question is from 4861.
Hello, this is Tiffany Lane again. Just a follow-up. So if let's say a patient is in the hospital on oxygen or on a ventilator, would a vaccine even be effective? Would that be someone who would be administered a vaccine, and would they be one of the priorities?
Well, I think that the answer to that question belongs to the team who is managing that particular patient. What we follow is a general recommendation, which is mostly what we do with people who are out there in the community in ambulatory basis properly said. So when it comes to patients who are being managed at the hospital for any condition, then the decision of management of that patient falls into their attending physician and the team working with that patient.
Your next question comes from Alex.
Hey there, it's Alexandra Meeks with CNN. Do you have a number of how many hospital personnel at UMC were vaccinated this morning? And second, do you have any details on that you could share about how large the vaccine shipment was? Thanks.
John?
Yes, well, I know that we took out 100 doses to be thought out, 105, I believe, 105 to be taken out to be used within the 5 days. So I would expect that's what they were expecting to do today. There, as many immunization programs run, we start slower and then build momentum as we get those processes finalized and fine-tuned. We received 12,675. Was that the amount? Yeah. Which were 13 bricks of 975 doses, and so that's what we received this morning.
Next up, Jackie Kostek.
Hello, I'm from Channel 13. My question is, we've been talking a lot about or hearing a lot about potential side effects for the vaccine. And I'm just wondering, are hospitals deciding individually how they distribute the vaccine amongst the healthcare providers? Or is there guidance from you guys? Just because I've seen a lot of places that hospitals don't want to vaccinate everyone in one department at the same time because of possible side effects, and then that whole department being out for a week or something like that. So I'm just wondering if that's a hospital-based decision or if that's you guys.
No, the decision is from the hospital, the organization receiving the vaccine. So they decide how they want to administer that to their employees. They, based on out of concern from possible side effects, they might decide to divide the employees according to the area where they work. But again, the decision is from the facility or organization.
And we have been talking to them for 3-4 weeks about this already. So they had a plan in place, and my understanding is the individuals who have like the day off the next day or so.
I'm going to take our next question from Tabitha Mueller.
Hello, this is Tabitha Mueller from the Nevada Independent, and I had a question about distribution. I was trying to get a sense of, what other hospitals might be receiving the vaccine today. What does the distribution plan look like? And are any of these initial doses going to, say, CVS, Walgreens for distribution to long-term care facilities? Or are we going to be waiting, and will that come in a separate batch? I know that's a couple questions, so I can follow up if you want me to follow up with that.
Okay. Regarding the CVS or Walgreens, I believe those will be coming next week. Mm-hmm. Joanne, you can get the
CVS and Walgreens will be receiving vaccine next week for the long-term care residents and staff. So that's a whole separate batch than what we're receiving. And then we received our, I'm sorry, what were the other questions?
About the distribution plan.
The distribution to the hospitals. We're still contacting them right now to determine when they want to receive their vaccine. Keep in mind that there is a lot of planning, that goes into vaccinating a workforce. So they may decide to wait till Wednesday, but we're contacting them at this point.
Right. I just want to add again that the original plan of distribution was for Wednesday.
Mhm.
And that's why we are contacting them just in case they want to start early.
Mhm.
Okay, I'm going to go to someone who hasn't asked the question yet. This is a caller ending in 9384. There you go.
Hi, it's Cynthia from Telemundo. Sorry for the delay. My question is for Dr. Ligon. Si nos puede dar la misma información rápidamente en español sobre las dosis que han recibido aquí en el Valle y la manera que se van a distribuir.
Okay.
Hi, it's Cynthia from Telemundo. Sorry for the delay.
Sure. Okay. Okay. I will go Spanish then. Sí. Esta mañana recibimos 12,675 dosis de la vacuna de coronavirus de la compañía Pfizer, y comenzamos la distribución de esta vacuna a los hospitales locales. Hoy le hicimos esa distribución al hospital de la Universidad UMC, University Medical Hospital, y ellos ya comenzaron esta mañana a administrar esa vacuna a enfermeros, médicos y trabajadores de su hospital. El resto de la semana vamos a estar repartiendo la vacuna a los demás hospitales de aquí del sur de Nevada. Repito, en total son 12,675 dosis. Estamos esperando envíos adicionales de vacunas en las próximas semanas, que se unirán posiblemente la vacuna también de Moderna, que va a ser presentada al gobierno federal, al FDA, esta semana, y esperamos que sea aprobada, y de ser así, pues también recibiremos envíos de esa vacuna la próxima semana, que entonces sería vacunas de Pfizer, como la de hoy, y en adición a eso, las vacunas de Moderna también. Y los envíos van a ir incrementando según pasen las semanas. También la próxima semana vamos a recibir envíos de vacunas que van a ir directamente a las farmacias de Walgreens y CVS para que sean administradas a hogares de ancianos. Gracias.
Okay.
Okay, Corey.
Next up, we've got Sally from Channel 8.
Hi there. My question, excuse me, I'm gonna hang up this call. My question is a little bit about, a lot of people are obviously hesitant to get the vaccine. I think we've been talking about that. I think we're well aware of that. But in particular to the Hispanic community, how are we gonna target for them to get it? I know a lot of people in my community struggle with even just going to the hospital. So what are we going to be doing to let them alleviate a little bit of that stress that they're going through right now, whether they're thinking, should I get it? Should I not? Do I even qualify for something like this? Is it going to cost me? So anything that you guys have been planning, any strategies?
Sí, yeah. Well, we have been working with the county and also community partners, developing a communication plan with the Hispanic community and also with the community at large. We also plan in future weeks or days to meet with representative of the Hispanic community, whether it is, you know, a local church or other community-based organizations, and ask them to help us deliver that message. We understand that for some segments of the community, it's not enough to receive the message through the TV stations or the radio stations or the written newspaper. They also need to hear from their own local leaders. So we want to engage a representative of the community to help us deliver that message to the Hispanic community as well.
Okay, we're going to go back through our list of follow-up questions now. First up is John.
Thanks. I believe this vaccine, it's 2 separate shots. So that 105 doses, was that included? So 105 people or 105 individual shots? And how far between those 2 shots are they administered? Are they at once, or is there like a booster essentially a day or 2 later?
Well, this vaccine should be administered 2 doses, and they should be 3 weeks apart. It's about 21 to 23 days apart. So today, the 105 doses will be 105 individuals receiving the vaccine.
Yes, and the second dose is already accounted for as far as the vaccine suppliers. So they have that dose set aside already when the first dose is given.
Next up is caller 5996.
Hi, everyone. Jacqueline from Fox 5 again. Wanted to, and I know this is a little more forward-looking, but for anyone 16 and up, how does the health department plan to administer that? Any thoughts about, I know that there's going to be larger sites in the future, but especially for tier 2, is there any talks about maybe going to schools to give the doses to teachers and to anyone perhaps 16 and up? And then anything else forward looking for the public to look forward to?
Okay, Jeff?
Yeah, so yes, we part of our planning for the distribution and the rollout of vaccine is to have multiple venues and locations spread throughout the valley where not only specific tier groups can get vaccinated, but eventually once we get to tier 4 and we are opening a mass vaccination site in the community, the venues will be much similar to the COVID testing sites that we've seen. We might leverage the resort properties that have not opened, where they have a parking structure. It might be local high schools, definitely community centers and senior centers are locations for providing the vaccine. Now, the fortunate thing about this vaccine, which is different from when H1N1 mass vaccination, the last large venue mass vaccination event we did in 2008, 2009, is that we have a public-private partnership. So CVS, Walgreens, and other healthcare providers continuously providing vaccine will mean that the availability of that vaccine for the general public will be more prevalent. So we're optimistic and very happy to have received this vaccine so early. And now we can begin the process to work through the subgroups within each tier and eventually get quickly down to the general public tier. And, you know, I think it's a really positive in our community. A lot of the efforts that we've been doing for COVID testing is to slow the spread of disease. This is now something in our toolbox and arsenal that can really help us prevent the spread of disease and get our community back to working and resuming some of its operations pre-COVID.
We're going to take just 3 last follow-up questions and then we'll wrap it up for today. First up is the caller ending in 4861.
Hello, this is a follow-up on the -80 freezers. So talking about that, I know some universities have some, but how many do we have in Southern Nevada? Are they at the hospitals and the universities? And then what's the process of delivering those to the locations? Does the hospital say, hey, I need this many, and the university sends over? What's the process of distributing those vaccines from those -80 devices?
So yes, so there is one at UNLV. We have one, and then there are some hospitals that have the ultra cold. They need to be registered with the state first, so that it can be monitored correctly, and some education with the vaccine. So actually, providers that are signed up with the state can order it directly. They will not have to get it through us eventually. So a lot of the ways that you get flu vaccine right now is going to be available, like through your doctor, through the pharmacies, and the university plans on vaccinating too as well. So that's kind of how it works. It was just sent to us first for the first time. So we have a little bit more control over it. And then from this point forward, we plan on providers getting their own vaccine.
Okay, our 2 final questions from today come from Jackie and Alex. Jackie, you are up first.
Awesome. So this is similar to Sally's question that she asked about the Hispanic community, but I'm just curious about the healthcare community. Is there any sense of how confident people are in this vaccine? It's a little scary having to be, I imagine, the first one. Exciting, but I imagine there is a little bit of fear involved as well. So have you heard from any folks that are getting it, or or choosing not to?
Right, we actually sent out surveys prior to this. And looking at one hospital survey, it looks like around 60–70%. We surveyed our own, and we had about a similar number. And maybe some other groups on the tier were about 50–50. So I think there was a very positive mood this morning when we delivered the vaccine, and people seemed to be happy and anxious and ready to get the vaccine. So remember, these people are working on front lines every day with COVID patients, and they can see the devastation, and they can see what exactly happened. So they are very happy to get the vaccine to protect themselves.
And last question for today comes from Alex.
Hey there, Alex with CNN again. Just a quick follow-up to my question about the hospital personnel at UMC that were vaccinated this morning. You mentioned the shipment arrived around 10:30 and then staff began vaccinating shortly after. I'm just wondering if you have roughly a time that, and like, was it immediate within minutes or hours? And lastly, have all of those 105 that you mentioned, those vaccines that were allocated today, have all of those been used? Thanks.
Yeah, I'm not sure. I mean, UMC, it does take a little bit of time to vaccinate 100 people. So I'm not sure if everyone in line got their vaccine yet, but it's my understanding that they plan to give that whole allotment this afternoon. One thing with the vaccine, we had to, once we put it in the freezer and then we take it out, we have to wait 30 minutes for it to thaw out at least. And then it has to be diluted and then used within 6 hours. So we were still on our, I would say it was 11:30 by the time it was in their freezer, 11:15, somewhere around that. So they probably started vaccinating around noon, I would imagine.
All right, thank you all for joining us today. Get in touch with the Office of Communications if we can help you in any other way. And always remember to continue spreading the message to mask up, back up, and wash up so we can all step up to slow the spread of COVID in our community. Thank you all for joining us. Until next time, goodbye.
You.
Bye-bye.
Bye.